I'm Bianca Clarke, a cognitive behaviour therapist from Bupa. Panic attacks can be scary. You may shake, sweat, your heart rate speeds up, and it can feel life-threatening. And sometimes people with panic attacks might end up in A&E. But with the right support and treatment, it can be managed. Finding accurate advice online about panic attacks can be hard though. You may have found lots of conflicting information in the past. I've made this short film to bring you evidence-based information about panic attacks. I will talk about what's going on during a panic attack, the signs to look out for, the treatments that are available, and also how you might be able to help yourself. A panic attack is a sudden episode of intense fear or discomfort, and it often feels like it can come out of nowhere. Panic attacks usually come with quite strong physical symptoms like nausea, increased heartbeat, sweating or shaking. This is your body's natural response to anxiety. It's the fight, flight or freeze system. It's there to help you respond to danger and it keeps you safe. During a panic attack, this fight or flight system kicks in, but there's usually no actual danger there. For some people, panic attacks become quite frequent, and that's when we might diagnose a condition called panic disorder. But not everybody who has a panic attack will have panic disorder. People with panic disorder might avoid places or situations out of a fear of having an attack. The symptoms of panic can be quite intense. You might experience things such as a racing heartbeat, sweating, feeling dizzy or faint, chest pain, shaking, shortness of breath, feeling detached from your body, and even a fear of dying or going crazy. The good news is that panic attacks and panic disorder are treatable. The first choice treatment is cognitive behaviour therapy, or CBT. It's a talking therapy that helps you to spot the unhelpful thoughts that trigger panic, like I'm going to faint. CBT teaches you to replace them with more realistic ones like I'm in control. It also helps you to build confidence and start to face situations that you're afraid of. In some cases, doctors might also suggest medications like SSRIs, which are antidepressants that can reduce anxiety symptoms. You can also learn techniques to manage panic attacks like slow-paced breathing. This is a simple technique that you can use to calm the symptoms of a panic attack. Here's how to do it. Breathe in through your nose for 4 seconds. Hold for 2 seconds. And breathe out through your mouth for 6 seconds. And repeat this for 5 minutes. This is a technique that you can use as a quick control technique in an emergency situation where you feel really quite anxious or quite stressed and want to just calm things down. But you can also use this as a general relaxation technique. So maybe when you wake up in the morning, first thing you do, 5 minutes of deep breathing, and that can set you up nicely for your day. A question that I'm often asked is, why do my panic attacks feel so scary? And the reason they do is because it feels like something is seriously wrong. You might feel that you can't breathe, or you might feel that you're going to faint. As therapists, we call this the catastrophic misinterpretation. This is when a person might misinterpret the physical symptoms that their body is giving them. So for example, if their heart is racing, they might fear that they're about to have a heart attack. Or if they feel dizzy, they might fear that they're about to have a faint and something serious might happen to them. Treatments like CBT can help you understand and reframe that response so the fear cycle starts to get weaker over time. Panic attacks are frightening, but they can be managed and they can be overcome. Thanks for watching. You're already taking a positive step by learning more.